of the heart. These are the great cardiac vein, the middle cardiac vein, right marginal vein, posterior vein of the left ventricle, the oblique vein of the left atrium, the anterior cardiac vein, and the vena cordis minimi. Now, coronary sinus. Can you see this is the coronary sinus? Okay, this is the opening of the coronary sinus, and this is the coronary sinus in the cadaveric heart. Coronary sinus is the largest vein of the heart, situated in the left posterior coronary sulcus, about 3 cm long. It ends by opening up into the posterior wall of the right atrium. It receives the following tributaries. The great cardiac vein accompanies the anterior interventricular artery, so the great cardiac vein, and then the circumflex artery to enter at the left end of the coronary sinus. It receives the left marginal vein from the left ventricle. Can you see it's the left marginal? Okay. Now, the middle cardiac vein. Okay. Here. Initially, we saw the great cardiac vein. This is the great cardiac vein. It's the posterior surface. It goes anteriorly in the anterior atrioventricular groove along with the anterior descending artery. The middle cardiac vein, so the middle cardiac vein accompanies the posterior interventricular artery and joins the middle part of the coronary sinus. This is the coronary sinus. Now, the small cardiac vein accompanies the right coronary artery. Okay. It's the small cardiac vein in the right posterior coronary sulcus and joins the right end of the coronary sinus. So the right end of the coronary sinus. The right marginal vein may drain into the small cardiac vein itself. The posterior vein of the left ventricle runs on the diaphragmatic surface of the left ventricle and ends in the coronary sinus over here. Right? Now, the oblique vein of the left atrium or the vein of Marshall is a small vein running in the posterior surface of the left atrium. It terminates in the left side of the coronary sinus, developing from the left common cardinal vein or the duct of Cuvier, which may sometimes form a large left superior vena cava. The right marginal vein accompanies the marginal branch of the right coronary artery, may drain either into the small cardiac vein or may open directly into the right atrium. The anterior cardiac veins are 3 to 4 small veins which run parallel to one another in the right ventricle and usually open directly into the right atrium through its anterior wall. The venae cordis minimi. The venae cordis minimi or the Thebetian veins or smallest cardiac veins are numerous small valveless veins present in all 4 chambers of the heart which open directly into the cavity. They are more numerous on the right side of the heart than on the left. Right? This may be one of the reasons why left-sided infarct are common. Coming to the lymphatics of the heart. Lymphatics of the heart accompany the coronary arteries and the 2 trunks. The right trunk ends in the brachiocephalic nodes. These are the brachiocephalic nodes over here. And the left trunk ends in the tracheobronchial lymph nodes at the bifurcation of the trachea. The tracheobronchial lymph nodes. Nerve supply of the heart. The parasympathetic nerves reach the heart via the vagus. They are cardio-inhibitory and on stimulation slow down the heart rate, whereas the sympathetic nerves are derived from the upper 4 to 5 thoracic segments of the spinal cord. These are cardio acceleratory and on stimulation increase the heart rate and also dilate the coronary arteries. Both the parasympathetic and the sympathetic nerves from the superficial and the deep cardiac plexus, the branches of which run along the coronary arteries to reach the myocardium. The superficial cardiac plexus is situated below the arch of aorta and in front of the right pulmonary artery, formed by the superior cervical cardiac branches from the left sympathetic chain and the inferior cervical branch from the vagus. Okay, here is the vagus, here is sympathetic. You can see the branches coming from vagus and the left cervical cardiac branch. This plexus is connected to the deep cardiac plexus, the right coronary artery, and to the left anterior pulmonary plexus. The deep cardiac plexus is situated in front of the bifurcation of trachea and behind the arch of aorta. It is formed by all the cardiac branches derived from the cervical and the upper thoracic ganglia of the sympathetic chain and the cardiac branches of the vagus, the recurrent laryngeal nerves. You can see these are the recurrent laryngeal nerves here running in the tracheoesophageal groove, except those which form the superficial plexus. The right and left half of the plexus distribute branches to the corresponding coronary and the pulmonary plexus. Separate branches are given to the aorta. Now, so cardiac pain is a type of an ischemic pain caused by incomplete obstruction of a coronary artery. Axons of pain fibers conveyed by the sensory sympathetic cardiac nerves reach the thorax 1 to 5 segments of spinal cord, mostly to the dorsal root ganglia of the left side. Since these dorsal root ganglia also receive the sensory impulses from the medial side of the arm, forearm, and upper part of the front of the chest, the pain gets referred to these areas. Viscera have low amount of sensory output, whereas skin is an area of high amount of sensory output. So, the pain arising from the area of low sensory output is projected as coming from a high sensory output like the skin. So, the pain in the chest radiating to the jaw or to the left arm might signal a heart attack.